Kathy. I'm the pharmacy intern.
Hi, nice to meet you.
Nice to meet you. We're gonna go over some screening questions.
Okay.
This is our data collection form. Fill in question 1 and 2, their sex, age, height, weight, social and medical history, race, and their blood pressure values after screening. Before taking their blood pressure, check the patient's position. Make sure their legs are not crossed, feet are flat on the ground, arms are bent and rested on the table, and the patient is sitting up straight. Wrap the cuff around the patient's arm, making sure that the cuff is above the elbow crease and the blue marker is aligned with the brachial artery. Tighten the blood pressure cuff around the patient's arm, making sure that it's not too tight or too loose. Ask the patient to remain quiet and still as you take their blood pressure. Press on and wait for the value to be recorded. Have the patient stand up with their arm at their side for at least 1 minute. Press on and wait for the value to be recorded. Sanitize your hands and put on a pair of gloves.
Two hours later.
Make sure your station is prepped and ready to go. Your station should have the following supplies: a Band-Aid, alcohol pad, cotton swab, lancet, capillary, and note the black fill line, test strip, cholesterol machine, sharps container, paper towels, gloves, and hand sanitizer. Have the patient warm up their hands. You could also massage their hands to ensure good blood flow. Choose either the middle or ring finger to be pricked. Prep the alcohol pad and swab vigorously. Twist off the cap of the lancet. Do not pull. Do not prick the tip of the finger, prick on the side. Hook onto the patient's finger to ensure good pooling of blood. Prick the side of the finger and use the cotton ball to wipe off the first drop of blood. Fill up the capillary to the black line. Avoid touching the finger with the tip of the capillary and make sure no air bubbles are collected. When collecting the blood sample, do not milk the patient's finger. Ask the patient to hold the cotton ball to their finger and insert the test strip into the cholesterol machine. Using both hands and holding the capillary at a 90-degree angle to the cholesterol machine, apply the blood sample into the test strip. While waiting for the values to be recorded, which should take about 30 seconds to 1 minute, be sure to bandage the patient. Use the button on the right-hand side to scroll through the test values. Discard the capillary, lancet, and test strip into the sharps container. Discard all other materials into a trash bag. Don't knock over the sharps container.